everyone, welcome back. So today let's discuss the brachial plexus. First of all, what is plexus? Plexus is a network of nerves that supplies the body, and there are about 4 plexus in our body. One, we have the cervical plexus, the lumbar plexus, the sacral plexus, and finally the brachial plexus. Most nerves that supplies the upper limb arises from this brachial plexus. And the brachial plexus is formed by the union of the anterior rami of the C5, C6, C7, C8, and T1. This C5 simply means the 5th cervical vertebrae of the spine. So from the 5th cervical vertebrae of the spine to the 8th cervical vertebrae of the spine, and the 1st thoracic vertebrae forms the brachial plexus. So just like a tree, the brachial plexus has roots, and from the roots it has the trunks. Now those trunks divide into the cords and the branches. So we are going to take that one at a time. So the first one are the roots of the brachial plexus. So remember I said that the brachial plexus arises from the union of the anterior rami or branches of C5 to T1. So the roots we have C5, C6, C7, C8, and T1. So this root forms the trunk. So the C5 and C6 together forms the upper trunk. As you can see, the C5 and the C6 together forms the upper trunk, while the C7 is formed by only the middle trunk, and the C8 and T1 together forms the lower trunk, which simply means that the brachial plexus has 3 trunks that comprises of upper trunk formed by C5 and C6 roots, and the middle trunk formed by the C7 only, and the lower trunk formed by the C8 and the T1. Now let's go over to the divisions. The divisions arises from the trunk. So each of the trunk divides into 2. The first is the anterior and posterior. Anterior and posterior. Same goes for the lower trunk, which simply means that the upper trunk divides into anterior and posterior divisions, while the middle trunk also divides into anterior and posterior divisions, and the lower trunk also divides into anterior and posterior divisions. So from the cords, so let's take the cords. There are about 3 cords of the brachial plexus. We have the lateral cord, the medial cord, and the posterior cord. So how does the lateral cord, the medial cord, and the posterior cord forms? Now let's take it. Remember I said that each of the trunk are divided into divisions. So the lateral cord is formed by the anterior division of the upper trunk, okay? The anterior division of the upper trunk and the anterior division of the middle trunk give us the lateral cord. Do you understand? So the anterior division of the upper trunk and the anterior division of the middle trunk gives us the lateral cord. Then let's go over to the medial cord. The medial cord is formed by the anterior division of the lower trunk. So the anterior division of the lower trunk alone forms the medial cord. Now let's go over to the posterior cord. The posterior cord is formed by the posterior divisions of the upper trunk, the posterior divisions of the middle trunk, and the posterior divisions of the lower trunk, which is this coming from the upper trunk, posterior division of the middle trunk, and the posterior division of the lower trunk forms the posterior cord. So let's take it again. The lateral cord is formed by the anterior division of the upper trunk and the middle trunk, while the medial cord is formed by only the anterior division of the lower trunk. Then the posterior cord is formed by all the posterior divisions of all the 3 trunks, which is the posterior division of the upper trunk, the posterior division of the middle trunk, and the posterior division of the lower trunk, which gives rise to the 3 cords of the brachial plexus. Now let's move into the everyone. So let's go over to the branches of the brachial plexus. Remember that I told you that the roots together forms the trunks, and the trunks gives us the divisions, which are the anterior and the posterior divisions. Then these divisions form the cords, and then the cords gives us branches. So there are branches coming from the cords, there are branches coming from the roots, and then there are also branches coming from the trunk, specifically the upper trunk of the brachial plexus. So let's take the branches coming from the cords. The first one is the lateral pectoral nerve. So this means lateral pectoral nerve. Then this lateral pectoral nerve supplies the pectoralis major muscle and the pectoralis minor muscle. When I talked about the insertion of the pectoralis minor muscle and the coronary process of the scapula, in my video on the scapula, I explained the pectoralis major, the pectoralis minor muscle perfectly. So you can watch my video to understand that. Now let's talk about the next one, which is the musculocutaneous nerve. This musculocutaneous nerve supplies the muscles of the anterior compartment of the arm, such as the coracobrachialis, the biceps, and the brachialis. So these are the muscles of the anterior compartment of the arm. Then the last one is the lateral root of median nerve. So this lateral root of median nerve joins the median root of median nerve to form the median nerve. And this median nerve supplies the muscles of the anterior compartment of the forearm, except the flexor carpi ulnaris and the medial part of the what? Flexor digitorum profundus. Now let's go over to the branches from the medial cord. Now you can use m raised to the power of 4u to remember that. So the first m is the median root of median nerve, which we join together with the lateral root of median nerve to form the median nerve. And I already told you the muscles that the median nerve supplies. So let's go over to the next one, which is the medial pectoral nerve. Okay, this medial pectoral nerve also supplies the muscles of the P major, that's the pectoralis minor muscle, and the pectoralis major muscle. Then the next one is the medial cutaneous nerve of arm. So this medial cutaneous nerve of arm gives sensory innervation to the skin because it's cutaneous to supply the medial aspect of the arm. While the medial cutaneous nerve of the forearm gives sensory innervation to the skin to supply the medial aspect of the forearm. Now this ulnar nerve supplies what? The flexor, that's some of the muscles of the anterior compartment of the forearm, like the flexor carpi ulnaris and the lateral aspect of the what? The medial aspect, of the flexor digitorum profundus. So this one supplies the medial aspect of the flexor digitorum profundus, while the median nerve supplies the lateral aspect of the flexor digitorum profundus. Take that. So let's go over to the branches from the posterior cord. So the branches from the posterior cord include one, the lower subscapular nerve. This supplies the teres major muscle. Then the upper subscapular nerve that supplies the subscapularis muscle. Then N stands for the nerve to the latissimus dorsi. This is also known as the thoracodorsal nerve and supplies the latissimus dorsi muscle, which is seen at the inferior aspect of the inferior angle of the scapula, and is also known as the climbers muscle. So please watch the video on the scapula to understand it better. Now let's go back to the next one, which is the axillary nerve. This nerve supplies the deltoid and the teres minor muscle. Now the next one is the radial nerve. This nerve supplies the 12 muscles of the posterior compartment, or you can say the back of the forearm. So these are the branches that are coming from the cord. Now let's talk about their root values, okay? So this first one, that's the branches coming from the lateral cord. Its root values are C5, C6, and C7. So this other one, branches coming from the medial cord, they have their root values as C8 and C1, except the ulnar nerve that has its root value from C7, C8, and C1. Then the branches that are coming from the posterior cord have their root values as well. C5 and C6, but there is an exception. The radial nerve that has a script value from C5 to T1, and then the nerve to the latissimus dorsi, that's the one, the thoracodorsal nerve that has its root values from C6, C7, and C8. So these are the root values of the branches from the cords of the brachial plexus. Now let's go over to the branches from the roots of the brachial plexus. The first one we are having the nerve to the rhomboideus, or you can call it the dorsal scapular nerve, the dorsal scapular nerve. So this nerve supplies the rhomboideus major muscle, and it also supplies the rhomboideus minor muscle, and also it supplies the levator scapulae. You are going to see this muscle lining on the dorsal aspect of the word scapula. When we are talking about muscular attachment, please watch my video on the scapula. You really understand this better. Now let's go over to the next one, which is the what? The nerve to the serratus anterior, or we can call it the what? The long thoracic nerve. So the nerve to the serratus anterior is coming from what? C5, C6, and C7. So this is nerve to serratus anterior, and as the name implies, it definitely supplies the serratus anterior muscle. Okay, this muscle is seen on the costal aspect of the scapula. Okay, an injury to this muscle causes the winging of the scapula. Then the last one we are having coming from the roots is the branches to the longus colli and the scalene muscle. This has its root value from C6, C5, C6, C7, and C8. So this branches to the longus colli and scalene muscle. So these branches to longus colli and scalene muscle are coming from both the brachial plexus and the cervical plexus. Okay, for the brachial plexus is coming from these roots. Then let's go over to the branches coming from the trunk of the brachial plexus. Then the branches coming from the upper trunk of the brachial plexus are, the first one is the nerve to that the suprascapular nerve. This muscle supplies the supraspinatus and the infraspinatus muscle. So that's what this nerve supplies. And their root values are C5 and C6. So let's go over to the next one, which is the what? The nerve to subclavius. So the nerve to subclavius supplies the subclavius muscle that is seen on the inferior aspect of the what? Clavicle. So this muscle has its root value from C5 and C6. Okay, so that is for the branches that's coming from the brachial plexus. So I've told you the branches coming from the cords, and I've given you their root values and what it supplies. Branches coming from the roots, I've told you their root values and what it supplies. And branches coming from the trunk, I've also told you the root values and what it supplies. So the next thing that we're going to be talking about is the clinical correlate of the brachial plexus. So the first one we are having is the Erb's paralysis, or we can call it the Erb's-Duchenne palsy. The Erb's-Duchenne palsy. So this result, or this occurs as a result of undue separation of the head from the shoulder. Take for instance, when a midwife is giving birth, then there is an undue separation of the head from the shoulder. It leads to Erb's paralysis, or the Erb's-Duchenne palsy. It can also occur as a result of fall from the shoulder. And what happens when someone comes down with Erb's palsy? What happens is that the site of injury, which is the site of injury is at the upper trunk. Okay, remember that two things form this upper trunk. Now these two things, that's the C5 and C6, give rise to this upper trunk. So when there is an injury to this upper trunk, what happens? There is what? A damage at the nerve involved. So the nerve involved will automatically damage. Now what are the nerves involved and what are the muscles that it supplies? What muscles will now be affected? Now let's look at it. Remember that this upper trunk gives off the anterior and posterior division, and this anterior division is what forms the lateral cord. So one of the nerves, that's the musculocutaneous nerve that supplies the anterior compartment of the arm, would be what? Affected. Now remember that the posterior division of the upper trunk also gave rise to the posterior cord. Now one of the nerves that's going to be affected from the upper trunk is the axillary nerve that supplies the deltoid and the teres minor. So these muscles are going to be affected. And when this muscle is affected, what deformity arises? Now if the person is going to have to look like this, okay, we'll call it the policeman tip, just like the waiter's tip, and the person is going to look exactly like this. So what happens? Now you know this is your arm and this is your forearm. Now this forearm is extended and pronated, like going backwards, it's pronated. So it's going to be like this. It's going to be extended and pronated. Now this arm is going to be adducted. Remember, it's going to be ADD, adducted, and then the medial rotation, medially is rotated, okay? This is what happens. This is exactly what happens. That the arm is going to be adducted and medially rotated, okay? While the forearm is going to be extended and pronated. Now, what are the things that are being lost? So what is going to be lost is that the arm, that's lateral rotation of the arm is going to be lost, okay? And not just that, the forearm, what is going to be lost is what? Flexion and what? Remember that it is extended and pronated. So what is going to be lost is flexion and supination of the forearm are lost. While the arm, lateral rotation of the arm and abduction of the arm is also what? Lost. Do you understand? Yes, so that's exactly what is lost and what happens when somebody comes down with Erb's paralysis or Erb's Duchenne palsy. Now the next one we're talking about, we're going to be looking into is the Klumpke paralysis. Now let's talk about the Klumpke paralysis. Now just like the S paralysis, this Klumpke paralysis is affected at the lower trunk. So at the Klumpke paralysis, the site of injury is at the lower trunk. Now if the site of injury is at the lower trunk, what happens? What automatically happens? It simply means that this place is going to be affected. Just like you are holding something. I'm holding this thing and my hand is cut off. What, like this place is cut off rather, what do you think is going to happen? This is going to fall off, right? This is definitely going to fall off. So I won't have, this is going to be affected. So this is holding this thing. Like the roots is holding the trunk. The roots together forms the trunk, right? That the C8 and the C1 forms the lower trunk. So when the lower trunk is affected, the C8 and T1, that's the sensation, the nerve, okay, the nerve involved will be damaged, okay, it will be affected as well. So this C8 and T1 is going to be affected because this lower trunk was affected, okay? Now, what is going to happen? It will give rise to what we call the closed hand. Now, what do you understand by closed hand? Closed hand, okay, why is closed hand different? Because the nerve that is going to be affected is the ulnar nerve, okay? The ulnar nerve is going to be affected. Remember that the lower trunk is give rise to two divisions, anterior and posterior division. Then the anterior division of the lower trunk forms the medial cord, okay? And one of the nerves that the medial cord gives off is the what? Is the ulnar nerve. So the ulnar nerve is going to be what? Affected as regards to the what? So the Klumpke paralysis. That's claw hands. That's what is going to happen. So the person's hand is going to look exactly like this. Now, how does this claw hand happen? Let's say, for instance, a woman is giving birth, okay? A midwife is trying to give birth to a woman that the baby is in a breech position, and the person is drawing the baby from the hand. So what is going to be affected is the lower trunk of the brachial plexus that's going to cut the nerve or the nerves involved, which are the C8 and the T1, which involves the ulnar nerve that's going to give rise to what? Claw hands, okay? Now when the person has claw hands, the person's hand looks exactly like this, okay? That's the metatarsophalangeal joints are what? Flexed. Exactly. So they are not extended, they are flexed, okay? That's very, very correct. Another thing that can really cause the Klumpke paralysis is fall from a height. Like when someone is trying to fall from a height and trying to clutch something, okay? That can actually lead to what? The injury at the lower trunk, affecting the C8 and the T1. So I'm going to teach you how to draw your brachial plexus extensively under 15 to 20 seconds. Now let's go there. The first one we are having are the roots. We are having C5, C6, C7, C8, and C1. Now C5 and C6 are going to get married. C7 will not get married. C8 and C1 are going to get married. Then C8 and C1 are going to give birth to 2 children. C7 did not get married but probably adopted 2 kids as well. Then C5 and C6 gave birth, got married and gave birth to what? 2 children. Okay? Now let's call those the roots of the brachial plexus. These are the trunk and the divisions. Now remember that the divisions are the anterior division, the posterior division, the anterior division, the posterior division, the anterior division, and the posterior division. Now, how does the cord forms? The anterior division from the upper trunk. Remember that this is the upper trunk, this is the middle trunk, and this is the lower trunk. So the anterior division from the upper trunk, the anterior division from the upper trunk, and the anterior division from the middle trunk gives us the lateral cord. Then how does the middle cord forms? The anterior division from the lower trunk gives us the middle cord. So how does the posterior cord form? All the posterior division from all the 3 trunks gives us the posterior cord. Good. So now we've talked about the roots, the trunk, the divisions, the cords. Now let's go over to the branches. So the first is the lateral cord. So the lateral cord gives us 3 branches. That's the L and L. Then the middle cord gives us the 5 branches. That's M raised to the power of 4 and U. So this is M, like the medial root of medial nerve, the medial pectoral nerve, the medial cutaneous nerve of arm, the medial cutaneous nerve of forearm, and the ulnar nerve. Now the posterior cord gives us 5 branches. You can use lunar to remember it. That's the lower subscapular nerve, upper subscapular nerve, nerve 2, the latissimus dorsi or the thoracodorsal nerve, axillary nerve, and the radial nerve. Now the branches coming from the root include the C5, which is the dorsal scapular nerve, or the nerve 2, the rhomboids, that supplies the rhomboids major muscle, rhomboids minor muscle, and the levator scapulae, which is seen at the dorsal aspect of the scapula. Now let's go over to the next one, which is C5, C6, and C7, which is nerve to serratus anterior. Nerve to serratus anterior, that supplies serratus anterior muscle. Then let's go over to the last one on the root, last branches on the root, which is branches to longus coli and the scalene muscle. So we're having C5, C6, C7, C8. So branches to longus coli and scalene muscle. So that's for the branches coming from the root. So let's go over to the branches coming from the trunk, specifically the upper trunk. We have the nerve to subclavius and the suprascapular nerve. So we drew our brachial plexus under 10 seconds and we extensively explained it with the use of 15 seconds, right? So this is your brachial plexus extensively under 15 seconds. Thank you very much.